fast. Okay, at this point in the examination, I would introduce myself, associate with Meducate to the patient, and I would ask the patient's name and date of birth to confirm I was with the right person. I'd also ask them if they'd ever had a blood pressure done before. If they hadn't, I'd still explain it to them, explain that I was going to place the cuff on the upper arm, that will pump the cuff up, and it may feel tight. It shouldn't be uncomfortable, but if it is uncomfortable at any point, I'll stop and we'll start again. I'll also make sure that the patient's feet are apart, that he's sitting comfortably. I would also ask the patient whether they've just run in, or they've walked in, or they've had a caffeine drink, or maybe had a smoke or an alcoholic drink, because this would obviously affect their blood pressure. I would also appreciate if the patient had been sitting for about 5 minutes prior to the examination, so that they're in a relaxed state. Okay, I'm just going to get the equipment now. The first thing actually I need to do is actually assess the patient's systolic blood pressure, the base level systolic blood pressure. And in order to do that, I need to take it. If you can just turn around for me, please, sir. Like so. I'm just going to feel the radial pulse, which is located over the radius here, at the base of the thumb. I can feel the pulse. If I wanted to, I would time that to get an average rate per minute. And marks as a good, steady, regular pulse rate. It's not bounding, it's not thready. Okay, and that's a good regular pulse. I could also palpate the brachial pulse here if I want to get a stronger pulse for volume. But again, and that's located on the inside, the medial aspect of the bicep tendon on the upper arm. Okay, I'm happy with that. It's a good steady regular pulse. And now what I need to do is place the blood pressure cuff on the upper arm. I've asked the permission of the patient, which they've given me. I want to just make sure, of course, I've got the right cuff. One way of doing it is to measure it over the length of the arm, and I can see from this one will suit Mark's arm. Make sure that you have the blood pressure cuff in the right position. Mark, if you can just roll this up slightly. Ideally, we don't want any tightness around the upper arm, but for the purposes of the OSCE, I'm happy with this for the moment. Okay, so I'm going to place the cuff on the upper arm, put it on quite firmly, not too tight. Make sure that the tubes to the sphig and the pump are over the brachial artery, which of course they are. I now need to find the base level systolic blood pressure, and I do that by closing the valve on the pump, looking at the sphig like so. I'll place it on the table so I can see it. Find the radial pulse, and now pump the cuff up to a point where the pulse stops. When the pulse has stopped, that's a base level systolic blood pressure, which I've got at 115, 120. Okay, so I know that's his base level systolic. So I open the valve, release the pressure off the cuff. I don't want to leave this tight during the whole procedure. So whenever I can get a chance to deflate the cuff, I will do. It's much more comfortable for the patient. I now explain to the patient that I'm now going to place my stethoscope under the cuff, over the brachial artery. When I'm using the stethoscope, I make sure that the earbuds point forward, like so, and that I have the diaphragm activated. Yeah, that's it. Okay, I now place the stethoscope diaphragm over the brachial artery, like so. You can often use the cuff to keep it in place, but failing that, one can ask the patient to just gently hold that for me. Thanks very much. This involves the patient, which gives it more of a feeling of we're doing it rather than me doing it to them. Okay, I explained to the patient I'm going to pump it up again. This time I'm going to pump it up to 120 plus 30 millimeters of my mercury. I close the valve, I pump it up quite quickly to 120 and then 30 above that. Okay, so I now release and open the valve. By doing this, I'm listening for the first Krodkoff sounds. This is when the pulse will start, and you'll hear it quite audibly bumping away. And I'm looking at the spheek, and I've heard the first sounds at 122. Don't want to open the valve anymore because that'll decrease the pressure rapidly, because I'm waiting for the fifth Krodkoff sound, which are the last sounds I'll hear. And you'll hear it as a very faint tapping, which then vanishes, and that went at 78. Okay, so I'll release the valve, take my stethoscope off, just remove this, thank you very much. And I would like to repeat that another 2 times, just to make absolutely sure I've got a correct reading. The reading I got was 122/79, 78, 79. I'll now remove the cup. And obviously at this point, thank the patient. Put the equipment at one side and just gel my hands again. And that would conclude the examination, the blood pressure examination.
Thank you. Can you explain what you were listening for?
Yes, they're called the Krodkoff sounds. There's 5 of them. The most important ones are the first sounds, which is when the pulse comes back. It's been occluded, it comes back. Usually characterised by a loud pulse sound, very definite pulse sound, which then decreases in volume until it vanishes. The point at which it vanishes is the 5th Krodkoff sound, and that would be the diastolic. So I'll have the systolic blood pressure and the diastolic. In this man's case, 122/79.
Okay, thank you very much.
Thank you.